There's been a lot of discussion in recent years about so-called medical tourism. That's where Americans go overseas to have medical procedures done in hospitals in countries like Thailand or India in order to save a lot of money compared to what they would pay here. Well, we recently asked Americans whether they would consider going overseas for certain medical procedures, and let me show you the results. We gave Americans 5 different reasons that they would go overseas. Number 1 was for alternative medicine treatments. Maybe that's not surprising. The very word alternative implies something you might not be able to get in normal mainstream American medicine. Right off the bat, 29% of Americans said yes, they would consider going overseas for that treatment. Next, cancer treatment. Almost 1 out of 4 Americans, 24%, said they would go overseas or at least think about it if they needed cancer treatment. Hip and knee replacement, those are big dollar procedures that a lot of hospitals make a lot of money off of. 15% of Americans said they would consider going overseas for that type of procedure, 14% for heart bypass surgery, and 10% for plastic surgery. We also came back and asked another half sample of Americans if they would consider going overseas for these medical procedures, but then we said if you knew that the quality was the same as in the U.S., and that it would be significantly lower cost. We kind of reassured them of that in the question wording, and then all the numbers went up. You see it in front of you. For every one of the procedures, a significantly higher percent of Americans said, hey, they would consider going overseas for that kind of treatment. For example, look at cancer. 37% of Americans, over a third, say they would consider going overseas for cancer treatment, given that the quality was the same and the cost was lower, and over 1 out of 4, 27%, said they would go for hip and knee replacement, and 27% also said they would go overseas for heart bypass treatment. These numbers are not insignificant. When you've got up to 1 out of 4 Americans who would consider going overseas, that could potentially take a big bite out of American hospital revenues in this country. Remember, some of the most profitable procedures that hospitals do are exactly these types of things. The big ticket knee replacements, the big ticket heart bypass treatments, that's where there's a lot of money generated by hospitals and of course doctors. And if patients begin to go overseas to have these procedures done, it could create a significant dent in the profitability picture of American hospitals. I'm Dr. Frank Newport, Editor-in-Chief of the Gallup poll.